And so speaking of red or blue or political issue, so now that we have new administration, we have, you mentioned RFK Jr. at the Secretary of HHS, and then we have Marty McCary, who's FDA commissioner. Do you see any of this changing?
I would say this is the first time in all my years that I feel like there's true interest in wanting to get to the bottom of, what's happening with the mental health in America, that, just the overall health in our country. But I think there's one thing when you're from the outside coming in, you think it's going to be a lot easier. But then once you get in, you're like, whoa, this is a much bigger animal than anybody. I mean, it's so much money tied up. It's industry's worth. But I think if there's anybody, and if there's ever been who's more than lip service, I think there's been other people who've come in, but I feel like we're going to get, we've already seen conversations happening around, some of the changes but it's at least a conversation. And I don't think that's where I'm saying we have to realize as the public, it may not be as full 100% what we're going to get, but that's politics too. That if we get these little changes those little changes will eventually add up. It just is going to take time. But I'm happy to see that mental health has been a part of the MAHA Commission report, talking about, because I think something's not working. That's just all I'm going to say. Something's not working. If our health is getting worse, but the use is going up, it's the same thing what I heard last week with the veteran community, and is that the government has spent so much money in suicide prevention programs aimed at the veterans. We're talking over $550 million every single year thrown into prevention. Well, clearly not. The suicides keep going up, and the rate of prescriptions keep going up, and they're looking at that data, and we're like, we need to do something about it. But so that would be my answer in saying I think this administration is truly interested and wants to get to the bottom. Whether or not they will be able to make all the changes, get direct to consumer advertising off, some of those things are going to have to go through Congress, and we know Congress is part of the big playbook, and all the industries, because I think they all kind of work off big food, big pharma, big tech. They all kind of work off the same playbook. And so and you start seeing that it's all tied together too, right?